Thank you so much for joining us this morning. I see our attendee numbers are still ticking up. So we'll go ahead and get started because we are all education folks on the line this morning. And so we are prompt and we know how to make use of even a minute of time. Thank you for joining us this morning. I'm going to be communicating with my partner in crime, Elizabeth, who's running our slides this morning. Elizabeth, can you click to our next slide, please? Hi, I'm Rebecca Blanchard. I am our Senior Policy Advisor in the Secretary's Office in the North Carolina Department of Health and Human Services. And I have the pleasure of coordinating our school reopening and school operations efforts during our COVID-19 response as a state. And I really shouldn't say it's a pleasure. This is the hardest work that I've ever done, as I imagine that it is the hardest work that all of you have ever done as school leaders, but it's a real honor to lead this work. I am a private school graduate for my entire pre-K through high school experience in Durham, North Carolina, where I'm born and raised and still live now. So this town hall today means a lot to me. Can we go to our next slide, please, Elizabeth? Before I keep going on and on with our introductions and we kick things off, we just want to do a little bit of housekeeping. So first of all, please make sure to respect other attendees by staying on mute. I know we're all very used to different video conferencing platforms at this point, but it has to be said. You can turn your video on or off, totally up to you. As questions come to mind, please enter them in the Q&A box and make sure to change the audience to everyone, not just to panelists. We want other folks to see your great questions as they come up because other people probably have the same questions that you do. And our team, whom I'll introduce in a second, will be monitoring the chat and making sure that one-off questions can get answered pretty quick, and then we'll make sure to ask them in the moment as our amazing DHHS leaders are speaking as well. If you can't see the Q&A box, you may need to click somewhere, potentially under my face, whatever you're seeing, or under the screen, and there might be a little question mark box. So you might need to click on that in order to be able to see the chat, the Q&A function. So just click on that and make sure to change the audience to everyone, not just panelists. And then last thing, this webinar is being recorded just as a resource for other non-public school leaders. So we can send this out to all attendees. Each of you will get a copy of the recording as well upon conclusion. So with that said, next slide, please, Elizabeth. Who are all of you and who are North Carolina's non-public schools? This is a very diverse group. And I know that my experience at my private schools in Durham is different from other folks' private school experiences across the state. There are almost 800 non-public schools in North Carolina. 22%, and that's probably low now, of all schools in the state are private schools. So more than 1 in 5. 65% of our private schools are religious. We have over 100,000 students enrolled in our private schools. And again, we think that's an underestimate now because this is from the previous school year. And given COVID trends, we anecdotally believe that there are more children enrolled in private schools now. And you all on the line are probably feeling that impact. But about 6.4% of all students in the state and K-12 schools go to private schools. In the bottom right-hand corner, you see that over 200 school leaders registered for this town hall. It actually might be higher than that, nearing 300 at this point. We know that all of you have ongoing questions about COVID-19, how you can best lead in your schools for your communities. And we are we're honored to be able to be with you today, to support you, to connect. And we're grateful that you registered and are spending your time here this morning. Next slide, please, Elizabeth. During our time together today, we will make the most of an hour and a half based on all of the questions that have been coming to the Department of Health and Human Services from non-public schools, to our local health departments, and from you directly reaching out to your school associations or to us directly. We're going to share information about COVID-19 so you are up to date on the latest research. We'll clarify what is required currently of our non-public schools across the state. We will highlight helpful communications resources for you, because policies and requirements are only as good as how they're explained to people and how folks believe in them and believe that they are important and believe that they will keep them safe. Communication is key. And you all as school leaders, you know that already. Most importantly, you're going to hear from your peers. We have a couple of local spotlights that we think are strong examples of just being excellent leaders for their school communities, and we're eager to get to what they have to say and hope that that helps facilitate connections between each of you. And then most importantly, we're here to answer your questions. Again, you can enter your questions in the Q&A box as we go along, but then we'll also have a portion at the end to take your questions live. Next slide, please. So here's our agenda. It's packed, and we have our State Health Director and Chief Medical Officer, Dr. Betsy Tilson, who we'll be handing it off to in just a few minutes. We have Jeff Coltrane, who's our Senior Education Advisor in the Office of the Governor, and Dr. Shanae Flood, who is our Director of the Division of Non-Public Education in the Department of the Administration. And then again, we have two school leaders who we're spotlighting, Kyler Kettner from Liberty Christian Academy in Durham, and Beth Peters from Greenfield School in Wilson. Next slide, please. We also have other folks on the line from DHHS who are ready to take your questions. We have Dr. Jean-Marie Millard and Larry Michael and Madhu Vulimiri, and there are some other folks on the line as well that we want to highlight for you. We have Charlene Wong, also from Duke University, who's also supporting our prevention efforts for the state, and she's a phenomenal pediatrician. I believe Walker Wilson, our Chief of Policy, is also on the line. In short, we have a lot of folks who are ready to listen to you, hear what's on your mind, and take your questions. Next slide, please. Without further ado, I'm going to hand it off to my colleague, Jeff Coltrane. For the last 8 months, Jeff and I have been working hand in hand, coordinating our school reopening efforts for the state. And in particular, I'm really honored to work with Jeff as we have been thinking about what it means to support our non-public schools in particular. And it's really been me and Jeff and Dr. Flood thinking about how we do that as a state. And I know that they'll have more to say about that. But Jeff, happy to hand it over to you. Thanks for all you do for our state.
Thank you, Rebecca, and thank you for all you're doing. It's been an honor to work with you as well. Go team. But I want to say on behalf of Governor Cooper, first off, thank you to all of our non-public school leaders for all you're doing to keep our students and staff safe during this unprecedented time. One of the governor's and Secretary Cohen's priorities during the pandemic has been trying to figure out how to get as many of our students back in school as safely as possible, because we know school is one of the most important things in our students' lives, whether it's a public school or a non-public school. Our schools play a critical role in not only supporting our students academically, but also with their physical and mental health, their socio-emotional learning, and everything else. And so the work that you're doing as non-public school leaders out there and helping to keep our students and staff safe is critical, and we appreciate you joining us today for this important discussion. I also want to acknowledge two other partners that have been critical in this work. Linda Nelson with the North Carolina Association of Independent Schools and Joe Haas with the North Carolina Christian School Association have been fantastic partners and collaborators. I know they and their teams at their associations have been doing a tremendous amount of work in supporting their member schools Just want to say thank you to them for that, and also for their collaboration and helping us to think through the best ways to support you as non-public school leaders. And I want to turn it over to one of our other critical partners, Dr. Shanae Flood, the Director of Office of Non-Public Education in the Department of Administration, who has also been critical in helping us to communicate and get information out to all of you non-public school leaders, and also in helping us to coordinate getting the face coverings that went out back this summer to all of you. So Dr. Flood, I'll turn it over to you for remarks as well.
Thank you, Jeff. Good morning and welcome everyone to this important town hall meeting. We have found ourselves in times that we never imagined we would be in. This is a time where we are having to depend on people and organizations that we may not have before. And I want to thank each of the school administrators for working diligently to keep their staff, their students, and families safe during this pandemic, while also providing the educational services that we know that they need. I want to thank Liberty Christian Academy and Greenfield School administrators for being willing to share the practices and protocols that they have put in place in their schools. And most importantly, I appreciate that you all are here with us today to learn more about the virus and ways that you can enhance what you're already doing for your school families. I believe we are stronger and better together, and your presence today affirms that for me. And so I want to say thank you again for all that you are doing to educate your students and keeping them safe during this critical time that we're in right now. Thanks.
Thank you so much, Dr. Flood, and thank you, Jeff. We are so grateful for both of you. The leadership from our administration and from the governor's office is what is going to end this pandemic in North Carolina. And we know that with the partnership of all of our non-public schools across the state, that the leadership of each of those schools impacts their own communities. Our school leaders are the trusted messengers. And we know that when each of you is sharing key ways to stop the spread of the virus, that your students are listening, that their families are listening, and that not only impacts the four walls of a classroom, but that impacts the community at large. Elizabeth, will you switch to the next slide, please? We might have some version control issues. Can you go back? Jeff, will you make it so I can share my screen? I just want to make sure that we're using the most up-to-date version, and it sounds like emails aren't going through, and I'll just share mine. We'll multitask a little bit. And with that said, Madhu is monitoring the chat, and so we appreciate in advance, again, everybody putting questions out there. Thank you so much, Jeff. So this is actually the perfect timing, because the next slide in our most final version is a few people that we want to thank. And just make sure that their efforts get recognized for all that they're doing for schools across the state. Linda Nelson, I know we already mentioned, but I want to now share my screen so you actually see it in writing, so you can really feel the love and appreciation, Linda. All right. Perfect. Hopefully people can see my screen. And now I think we got this. Wonderful. We want to thank Linda Nelson from the North Carolina Association of Independent Schools for all that she's been doing to partner with us along the way. We exchange emails pretty much constantly and are making sure that folks have up-to-date interpretation of guidance and just changes at the state level. We know things are moving quickly, and Linda, thank you for all that you're doing. And Mr. Joe Haas from the North Carolina Christian School Association, thank you for hopping on the phone with me and Jeff and for thinking through, what does it mean to support? As we said, 65% of schools across the state are religious, and we know that the North Carolina Christian School Association Association supports a chunk of those schools, and we're really grateful. We also have other folks on our team at DHHS who are providing support. So thank you to Sarah Freeman, Salona Patel, and Elizabeth Hahn for all that you guys are doing. All right. Without further ado, I want to hand it over to really the star of the show, which is Dr. Betsy Tilson, who is such a strong leader for our state as our Chief Medical Officer and State Health Director. She is going to walk through in a Q&A format that I'll be sharing some questions out loud that are pre-written based on comments and questions that you entered in when you registered for this webinar, or again, that you shared anecdotally with any of the folks really that are on the line today. And again, as questions come to mind, please enter those in the Q&A box. Dr. Tilson, are you ready?
I am surely ready. Yep. Can you hear me and see me okay?
We absolutely can. Dr. Tilson, here's our first question for you. It's just an important one. Set the tone here. What do we know about how COVID spreads, and what are we still learning now?
Yes, I'm happy to answer that question. But before I do, I need to correct you on something that you said a little bit earlier, that I am by no means the star of the show. I am purely a supporting actor. I think, all of you on the front lines, in the schools, in our communities, you all really are the stars of the show. The buck stops with you all. So grateful of all the hard work that you've already done and continue to do. Showing up even today to get even better at your job. Really want to thank and acknowledge you. And then all of my team members at the state level, both at DHHS and DPI and the governor's office. This is a team sport of no team sport has ever been like this. So thank you all for that. And I cannot let Becky say I'm the star of the show when I am one piece of a many person puzzle. So, but moving that on to what I am supposed to do is that I'm going to talk you through some of the basic science. So because you'll see that our policies and our recommendations and our guidelines and what you can do is really routed in really just some basic science. And so we get questions all the time about, should I do this? Should I do that? And if you really just center yourself and thinking through, what are we trying to do? What do we know about how this virus spreads? Then a lot of those answers come pretty easily, and they don't have to be too complicated. So I really wanted you to be routed in just the fundamentals of how this is spread. And then you can think through, okay, what does this look like? And then these same principles will translate into all these different settings. And it gets a lot easier to think through when you just remember what we're trying to do. So what we're trying to do is prevent the spread of this respiratory virus. And what we know is that the main way that this virus is spread is people to people through these respiratory droplets. So the respiratory droplets are the tiny little kind of liquid droplets that come out of your mouth and your nose when you're breathing or you're talking. What we know is that anything that increases the, what we call respiratory effort, or the effort of those droplets coming out of your mouth and nose, that will increase the spread of those respiratory droplets. So if you're talking loudly, cheering, yelling, singing, sneezing, coughing, anything that's increasing the force of those droplets coming out of your mouth, then you can more easily spread it. We also know that in general, those respiratory droplets, in general, probably travel no more than 6 feet. And so that is one of the reasons of thinking through that those 6 feet of social distancing. Now, there is a question that people ask a lot is, what about airborne? We've been hearing more that this can be in the air and travel longer, and how much do we need to think about that in circulation? There is probably an element of airborne, and what we know is that those places, very small places, indoor settings with lots of people, poor ventilation, there may well be an element of airborne spread in that, but that is still probably the minority of way that it is spread. It is still primarily spread, these respiratory droplets, person to person within 6 feet. Now, there is probably also an element of what we call an environmental contamination, or fomite, if you want to get really technical, which is those respiratory droplets fall onto a surface, and then the surface is contaminated, and then you touch the surface, and then you get the virus on your hands, and then you touch your nose and your mouth and your eyes. So we think that that is potentially a way of spread, but probably less than the respiratory droplets. And then finally, can you transmit the virus if you don't have symptoms? This is what we've been learning more and more and more about, and the answer is yes. And it is something that is somewhat unusual, or at least we don't have as much documentation of this as we do for more documentation in this respiratory virus and other respiratory viruses. But what we are learning more and more and more, and this is a reason for some of the changing in our recommendations. For example, our face covering recommendations, where in the beginning we were saying, no, you only have to wear a face covering or a mask if you have symptoms. And then we moved to universal face coverings because what we were learning was that half, maybe even as high as 75% of people that have the infection don't have symptoms and they don't know. And they have the infection, they don't have symptoms, they don't know, and they can still spread. So that has been something that has made this virus particularly difficult to control, is the high rate of people that don't have symptoms and the ability to spread when you don't have symptoms. So those are really foundational pieces, and then you'll see all of our guidances really track back to how is this spread and how are we trying to prevent the spread. Okay, next slide. Okay, right. Okay, so what are we seeing? I think you've seen all your numbers. I hope you've seen your numbers. I hope you've seen our new county alert dashboard. But unfortunately, what we are seeing is this virus is spreading very quickly across the state. We had a little bit of a peak in the summer. We had a little bit of a lull in the end of the summer, beginning of September, but we are seeing what we were expecting to see is a big uptick as we head into the fall and the winter. We do think that this virus is going to have a seasonality to it, same way our other respiratory viruses have, and we are seeing this. And so the next couple months, we are very worried about this vaccine. About this virus in the next couple months. The vaccine that you heard come in is that we are excited that there is a light at the end of the tunnel. We're excited that vaccines will come down the road, but it's going to be a while until we have enough vaccine for everybody to really change that path. So the next couple months are going to be critically important for all of our prevention measures until we have enough vaccine for everybody. Great. And then a little bit of what are we learning specifically about children and infection. And this one, I would say we are learning more every day. This is definitely evolving learning and data. And we're getting conflicting papers. Sometimes say that young kids can spread a lot. Other ones say that they can. And so we're seeing a lot of conflicting papers. But overall, when we look at those together, where some of the trends that we are seeing is that in general, it does seem that children, especially younger children, may be less likely to contract COVID than adults. They definitely can, but it seems like they may be a little less likely to contract than adults. Second, children, especially younger children, are more likely to have mild or no symptoms with the disease. And one of the things with that is that although you definitely can spread the disease when you don't have symptoms, you spread it more efficiently when you do have symptoms. And so what we're finding is that children, thankfully, have mild or no symptoms and seem to be less likely to spread than other people. One of it could just be because there's such a high prevalence of asymptomatic disease. The second is if you just think about the anatomy of a child, they're small, they don't have a lot of force behind their coughs, their sneezes, so you have that decreased respiratory effort. And especially the littler ones, they're below people's faces typically, so you're not getting that face-to-face spread. So there's lots of theories as to why this may be true. And the last thing that we are finding is that the highest rate of spread is within households. We definitely have spread in the community, but the highest place we're seeing spread is within households. So that's just a couple key points of some of the things that we are learning, but we are learning more and more every day. And this slide, you'll
Dr.
see
Tilson, I'm so sorry to interrupt. Would you mind just speaking a little bit closer to the microphone? Because I just want to make sure that everyone can hear everything you're saying. Thank you so much. I'm so sorry to interrupt.
Oh, no, thank you. Thank you. And I know it is very frustrating to be on the other end of not good audio. Is this better?
Yes, thank you so much.
Okay, wonderful. I'm going to stop my video then so you're not seeing my notes. There we go. Okay. So some of that you will see bear out in our state level data. This is a graph that looks at the rates of cases by age group. You will see that that purple line on the bottom is our child 0 to 17 rate, and you'll see although all the rates are going up for all the populations, you'll see that still our children, the 0 to 18, still have that lowest rate of cases across all of our different age groups. And on the next slide, we'll break that down specifically within our pediatric or our young adult or child population, and you'll see that breakdown. That kind of more teal bar, those are our college age students, 18 to 24, our young adults, where we do see pretty high rates in our young adults. But then you'll see the 17 and under broken down by those age groups, and seeing that the kind of younger you are, then the less likely that you are to be a case. So you'll see those kind of broken down by age. Okay, and then the last piece I think in this section is what are we seeing in schools and clusters in schools and spread in schools, and specifically for this webinar, thinking through our public and private schools. On the left, and this is one of the reasons that we really want to be sure that you all have all the information that you need, that we can get to you, to really try to decrease transmission in private schools as much as possible. Because one of the things that we are seeing is actually a disproportionate rate of clusters in our private schools as opposed to our public schools. And you'll see that on that pie chart on the left, that 61% of our cases that are linked to a cluster are actually coming from private schools and less than public schools. So we're seeing a disproportionality there. So that was one of the reasons we want to be sure you have all the information. The other thing that we are seeing on the right-hand side, which is a little bit interesting, is that in the public school setting, we typically are seeing more cases in adults than in children. In the private school settings, we actually are seeing that a little bit, we're seeing that flipped. We're seeing more cases in children than adults. So again, one of the reasons too, we want to be sure you're having all this information that you have, especially to think through what's going on with the children in your schools. Okay, great. Okay, so I'll just.
Sorry, I was going to unmute and actually, but I couldn't do it very quickly. I did just want to say one thing here, and Dr. Tilson, tell me if you agree. I think something that we've been asked frequently by private schools is, it seems that these clusters are very large in a particularly small group of private schools. However, the perception publicly is probably what matters the most, that the general public is seeing that private schools have more clusters, they have more cases overall. And so I think it's important, this is just my 2 cents here, that all of our private school leaders are thinking about cluster prevention, are thinking about preventing spread of COVID, period. And that when all of our private school leaders are sharing the same overarching messaging, are using the communications tools that we're making sure in your back pocket through this webinar, that we can all work together. And as Dr. Flood kind of hinted at, we really haven't done that with our private schools before as a state. And when we're thinking about private schools as a whole and mass, that's new for us, and we have to think that way. How can we together as leaders in education, how can we take action collectively? So for those of you who might be seeing these data and saying, this isn't my school, I caution you to think about this really collectively. Dr. Tilson, I'm sorry to interject there.
No worries.
Okay. Alrighty. What do we know about how harmful the virus can be in the short term and the long term?
Yep, and that's a great question, of course. So one thing is, and I alluded to this in the prior slides, that young, healthy people, not completely, but in general, tend to have milder disease, which is good. They can still get infected, they can still spread, but tend to have milder disease. And we do, data so far shows us that older people and those with underlying medical conditions, those are the ones that are more increased risk of severe illness. Not necessarily increased risk of getting infected, but increased risk of severe illness. So those are really of those acute and that short-term severe illness that might land people in the hospital or lead to death. So we do know that, but what we're also learning, if we go to the next slide, Becky, is that outside of that, just that acute, that initial phase, what happens in that first 1 to 3 weeks after that initial infection, what we're learning is that that's not the end of the story. It is not either you have mild disease and then you get over it, or you get really sick and you get in the hospital. But whatever is going to happen within a couple of weeks. What we are learning now more and more is that there is a longer term complications, longer term sequelae, and it is more than just, even though it is spread by respiratory droplets and some of those acute symptoms are respiratory or breathing troubles. What we are learning is that this doesn't just stop at the lungs. It really can spread throughout the body, and that what we're finding is it really mounts an inflammatory process or an inflammation that affects many different blood vessels, many different organs. So although it comes in through your respiratory tract and you have the effects of the lungs, it also can affect your heart and your blood and your brain and your neurologic system and your kidney system. So multi organ or system it can affect. And it's not just acute. What we're also finding is that people then can have symptoms up to 2 months, 3 months, 4 months after that infection because of this kind of widespread inflammatory process. And so fatigue, loss of memory and concentration, and these more ongoing neurologic effects, loss of smell or taste, sleep disorders, that these symptoms are going on longer. And you've heard the term maybe long haulers. Is that a way of just describing these people that are having these more chronic symptoms? And even in these the young people, 18 to 24, 1 in 5, or 18 to 35, 1 in 5 actually weren't back to their normal health, even about almost out to a month after their illness.
Which might be some of the teaching population in many of our schools.
Yeah. And the other piece on this that I feel we cannot stress too much is even if for people who don't have the infection, the mental health and the stress and the anxiety, the trauma that her whole population has experienced, again, not just for those who had the infection, but just this pandemic as a whole, the isolation, the trying to learn remotely, all of that this is something I think as a state and as a people, we are kind of appreciate the amount of the mental health and stress and anxiety for years to come. And so we want to be sure that you do know that there are some resources to really help provide that immediate and then longer term mental health support. I don't think we can underestimate the trauma and the mental health impacts of this pandemic.
Thank you so much for highlighting mental health needs, Dr. Tilson. That's a question that we know is on the minds of many of our private school leaders. We got that question quite a bit as folks registered. Yes. Now let's think about what we can do in our private schools to take action. What do we know about what actions actually help? How do we mitigate the spread of COVID?
And that is the good news. Yay, that we actually know that very basic preventive measures can be incredibly effective in reducing the spread of the virus. The challenge is doing that as much as possible, 100% of the time, as much as we can adhere to these preventive practices. If we can do that, they can be very, very, very effective in preventing spread. So it really is the behavioral modification. It's the getting people to do it. That is the challenge, not knowing what it is to do that we can reduce the spread. And so although I know probably everybody is sick of the 3 W's, and on the next slide, I will show you what science we have behind them, but they're incredibly powerful. No, not yet. I was just forecasting. Incredibly powerful to prevent the spread. And again, if we go back to that very first slide, how is it spread? Respiratory droplets that are coming out of somebody's mouth. You may be infected and not have symptoms. So that is why we are recommending wearing a face covering, covers your nose and your mouth all the time when you are not around people in your household, because that is the primary way that this is spread, respiratory droplets coming out of a person. The face covering really helps to prevent what we call source control, prevent those respiratory droplets from coming out of a person that might get to another person. But we also are finding more and more that it also can protect the other person for whom those respiratory droplets might be coming at. So it does protect both people, but its primary source is preventing those respiratory droplets from coming out of a person who may be infected with the virus. Weight 6 feet apart, as we talked about, the vast majority of respiratory droplets don't travel more than 6 feet. So if you can stay 6 feet away from people, your likelihood of getting that respiratory droplet from that other person goes down dramatically. And then washing your hands, this helps to prevent that source of infection if you touch a surface that has a virus on it and then you touch your nose and your mouth. The other piece is because this is what we call a socially transmitted disease. We are doing a whole campaign now for our young adults since we've adopted this. It's a socially transmitted disease, which means it is transmitted when people get together. So the fewer people that we can get together, then the lower the likelihood that one of those people has a virus and can spread to other viruses. So as much as people can avoid large gatherings and crowds as much as possible, that's incredibly important as well. Okay, on the next slide, I'll just bring you into, this is a recent paper with the reference up on the right that just shows a little bit of the data behind these 3 Ws. And what they did was they looked at data that if somebody was infected and then somebody came in contact with that person infected, what was the likelihood of that second person getting infected from that person who was infected? And what they found was that the risk of that second person getting infected by that infected person decreased by 85% with the social distancing, 77% by that other person always wearing a mask, 77% by keeping the duration of contact with an infected person less than 15 minutes. We talk about a close contact as someone within 6 feet for 15 minutes, and then frequent hand washing. So you can see some of the, really, this is incredibly powerful effectiveness data on these very simple preventive measures. And then we get a lot of questions about what time's the mask, what about a face shield, what else, how else can we give us more detail on that? So the first thing is that, as I alluded to, that our guidance and in our executive order is that people should wear a face covering when they're out of their house, they're in public, when they're basically around anybody who's not in their household. That's just the easiest way to say it. If you're leaving your house and you're going to be around people who aren't in your household, wear a face covering. That's really the simplest. You also want to be sure, yep, there we go, that if it does get wet or damp or dirty, that you want to be sure that it's clean. Really, cloth face coverings is what is recommended for the general population. You know, a medical mask or a surgical mask is fine, but we do want to be sure that there's enough for our healthcare workers. And then especially the N95, those higher level ones. They're not necessarily bad, but we want to be sure there's enough for our healthcare workers. And we have been pushing out cloth face coverings to our schools, as you probably know. Next slide. We do get questions about what about a clear mask, face shields, barriers, what else can we do? And first, I want to say that that cloth face covering is definitely the #1 recommendation. But we do know that it's really important for some student populations, some people to actually be able to see your mouth. There's a lot of communication that happens visually and by mouth. And so we also have guidance that especially if there's maybe a teacher who's working with a student who's deaf or hard of hearing and needs to see that mouth to really understand, or young children who really go off a lot of social cues, or people learning a second language, then there are clear masks that are available where it provides that barrier, but you can see that the face. So that clear mask is a nice alternative for those people. We also get a lot of questions about face shields. Can I use a face shield? And face shields, if you think about it, they are not tight against your nose and your mouth. They just are really in front of that person. There's lots of opportunity for that respiratory virus to go out from the bottom or to the sides. And so there really is no data to show that a face shield is effective, what we call source control that I talked about, that a face shield really prevents those respiratory droplets from coming out and then being spread. The face shield can protect the wearer. The face shield protects the wearer from another person's respiratory droplet, but doesn't necessarily prevent those droplets from coming out of the wearer. So what we recommend is that face covering, and then you can add a face shield on top for the extra protection if you want, but it's not, we don't have great evidence that that is a good source control. And same thing with plexiglass barriers. They could work, but what we want to do, the main foundational thing we want to do is prevent those respiratory droplets from coming out of the person in the first place. And so you could use these to layer, but not as a substitution. Okay, what about tests?
All right. Testing. We got a lot of questions about testing. I'm going to move us forward, Dr. Chilson, because timing is getting a little tight, but we want to talk about testing and COVID vaccines to make sure folks get key information. So what's the scoop on COVID testing?
Yep. So COVID testing, very basic. There are 3 types of testing that I want to be really clear about. There's 2 types that can actually diagnose you if you have an active infection. You've probably heard those. Those are like the PCR tests that are the most sensitive, and the antigen tests. They can both, those 2 types of tests can detect if you are currently infected. And then there's the antibody test, sometimes called the serology, that can potentially detect if you had prior infections. So just to distinguish between the diagnostic and then the past infections. They have different pros and cons. The antigen test, although it's quicker and easier, is a little bit less sensitive than the PCR, which is really the most accurate, but it's more complex and more cost. Great. We have lots of information on testing and potential recommendations for testing in a school setting. We have this guidance there. I recommend you going through that. We certainly recommend testing for any student or adult who has symptoms. We also recommend testing for those who are within close contact of a person with infection. And then we also talk about options for screening asymptomatic people. So not waiting for them to have symptoms or close contact, since we know there's such a high rate of people who may have the infection without symptoms. We talk through different strategies that you could adopt. Routine screening of asymptomatic people, maybe weekly screening of all your staff to start early detecting someone who is positive before they can spread into the population. And so we have that consideration for testing at schools in that guidance. We also have lots of testing resources at the state if people want to get tested. And so you see that on our testing page. There's the links. The community testing sites are really great. Those are the state-sponsored ones. They're free. We are having available a lot of places across the state. I actually brought my daughter to one of those when she came home from college. For the holidays, we wanted to get her tested before she integrated into North Carolina. It was really easy, quick. So I really encourage you to explore those community testing sites and make sure that those resources are available. Okay, and the last piece, we'll dive into vaccine. And I know lots of people want to know about vaccine, which is really exciting. It is our path forward, and so I'm very excited about it. A couple really important take-homes that I want you to know is that when we have vaccines available, they will be tested. There will be lots of eyes on the data to make sure that they're safe and effective. But to set expectations that when we have vaccine available, it will be available in very limited supplies in the beginning, and it will take a while for us to have enough.
Dr. Chilson, can you speak into the microphone a little bit more? Thank you.
Yes, I am so sorry. Again, we'll have very limited supplies in the beginning, but as we have more supply, we're very excited to really make sure it's available for everybody who is eligible and wants it. We will be starting, when we have a very limited supply, we are doing what's called a risk-based prioritization. And so those people at highest risk for exposure and highest risk for complications will be prioritized first. Our school teachers, those with 2 or more chronic conditions that put them at high risk for complications, they are in what we call our phase 1B. They'll be right behind our healthcare workers and our people in our nursing homes. And go back up to the prior slide. I'll be quick. Nope, the prior one. There we go. Yep, we'll go through that a little bit more, but we're really doing it on risk. And then the thing to point out with children is that currently children have not been enrolled in the clinical trials. We don't have data on children. We do not expect that any vaccine that is authorized or recommended will include recommendations for use in children until we have data. So it may not be later in the spring or the summer before we feel like before it is recommended or available for children and for students. But for staff and the adults, it'll be available earlier. Okay, next slide. Really briefly, I wanted just to go a little bit into the process of how this vaccine is developed on the federal level, because we get a lot of questions that concerned about safety and data because of the speed of which the vaccine has been developed. So there's just a couple pieces that I want you to understand that is foundationally important for how it is that we were able to get this vaccine more quickly than usual. First thing is that the technology, at least for these first two vaccines, Pfizer and Moderna, this technology has already been development and in the works for the past couple of years for thinking about other coronaviruses. So it's not a brand new technology. It's one that's been being developed for the past couple of years that could quickly be deployed for this specific virus. So we had a jump start on it. Second, the federal government made the decision to, while the clinical trials were going on, at the very same time to start production of vaccines. So whichever vaccine was found to be safe and effective, we would have supplies ready to go. So really got a great efficiency and speed there. And that's where you see those parallel lines. The third piece is going up to that top line is with the clinical trials, all the same steps that in clinical trials for typical vaccines is the same with this vaccine, the phase 1, phase 2s, phase 3s. There's been no shortcuts in safety and efficacy data. All those same things that have happened, but where we were able to get speed was one, we had a head start on this technology. Two, there were no gaps between phase 1, phase 2, phase 3. As soon as phase 1 started, they were planning phase 3 clinical trials, so there was no delay between the phases. And then the third part is in our phase 3 clinical trials, where we have a lot more people, because a typical phase 3 clinical trial has about 3,000 or 4,000 people. These clinical trials have 30,000, 40,000 people, so 10 times as many people in these phase 3 clinical trials that allowed the data on safety and efficacy to happen more quickly, because we had so many more people. And then all the authorizations and data review that is typical will be going on. It's just everything was done very without any gaps in between as efficiently as possible. Next slide. Great. Very briefly, I talked about this in the first phase. We mentioned it'll be our healthcare workers and our people like in our nursing homes. And then the next phase will be any adult that is high risk of complications, and then including our frontline workers, our teachers, anybody at high risk will be in that second phase. And then our frontline workers, our teachers who are lower risk, they'll be in that next phase. So we really consider our teachers, our frontline workers, prioritizing those teachers that again have higher risk of complications themselves before our lower risk teachers. But they're both, all of our frontline workers are pretty high up on our prioritization because of the risk of exposure. Next slide.
And Dr. Tillson, we've gotten some questions in the chat. Can you just clarify one more time when children will be able to have the vaccine?
It depends on when we have the data on that. They are right now, children up to 16 and over were included in the clinical trials. Some of the clinical trials are starting to include 12, children 12 and up, but so far none have included younger children. So it really depends on when children are included in the clinical trials and when the FDA and the CDC make the recommendation. So I can't give you a crystal ball. I know they will not be included in the beginning. It really depends on when they're included in the clinical trials and when the evaluation of the data and the efficacy can be translated to children. So I don't know, but it won't be in the beginning. Thank you so much.
I think that is it. We covered from start to finish kind of where we are on COVID. Dr. Tillson, thank you. You answered many of the questions that folks had top of mind for them, and we'll come to you at the end for more live Q&A with any relevant questions your way. Thank you. I'm going to share a little bit about what tools and resources are available to you as private school leaders to help stop the spread of COVID-19. First of all, we have released now specific guidance that is targeted to you. We had previously really been focusing our energy on releasing public school facing guidance. And 2 weeks ago now, we released private school facing guidance that puts out front and center exactly what are the requirements at this point in time that you have in your schools. And then we outline very specifically what are our strong recommendations that you also implement in order to mitigate the spread. I strongly recommend that you bookmark the NCDHHS guidance webpage. That is, there are a few different places that it's linked in this slide deck when you receive it after this presentation, but we are constantly updating files, updating PDFs to link to newest executive orders. So the links never change, although the files are updated automatically. So first, I want to highlight that the Executive Order 180, as I hope that each of you has already heard at this point, requires wearing masks in non-public schools. And as Dr. Tilson mentioned, we know that wearing a mask anytime you are with folks that are outside of your household is a key way that we can prevent the spread of COVID-19 in our communities. This executive order really aligned our school-based environments to what was already required in other settings across the state. So now everyone ages 5 and up, whether you're in a public school or a private school, is required to wear a mask when indoors at all times, and when outdoors, when you are within 6 feet of another person. Here are some examples. So of course, this can't be an exhaustive list. We've found it helpful when speaking with our school leaders. Let's give some examples of what these requirements actually look like in a school-based setting. So for example, if students are over the age of 5, I could say, or they are the age of 5, and they're with a teacher together inside a classroom, whether or not they are 6 feet apart, they are required to wear a mask. Anytime you are indoors in a school-based setting, in a private school-based setting, whether or not you are 6 feet apart, you are required to wear a mask. Same idea that if you are a 5-year-old and you're enrolled in a preschool, you are required to wear a mask. Some examples of settings where masks are not required. If kids are outside for recess and they are consistently maintaining 6 feet of social distancing at all times, they are not required to wear a mask. Same in an outdoor PE class. But if you switch that and you have an indoor PE class, as in the example above, you would need to wear masks. And we get this question quite a bit. If a teacher is alone in their classroom with the door closed, is that person required to wear a mask? No, they are not. We also get questions about exemptions for mask wearing. The list is here, but I think the most relevant one for our private school leaders would be children under the age of 5 are not required to wear masks. However, for children age 2 or above, the CDC and DHHS recommend that they do wear a mask, and they are able to. We see it quite frequently. Or if a child or an adult is actively eating or drinking. Those are the times when we would expect folks to take off their masks. We've also gotten the question, is giving a speech for a broadcast or to an audience, is that the same thing as a teacher teaching in the classroom? The answer would be no. A teacher teaching in a classroom indoors is required to wear a mask. In the most recent executive order, Executive Order 181, there are some clarifications around mask wearing and exercise, or strenuous, exercise activity and what's required. Again, it does reiterate that mask wearing is required when outdoors and within 6 feet of someone from outside of your household. Excuse me. However, this does highlight that if a person is experiencing dizziness or trouble breathing or lightheadedness while they are strenuously exercising, they should take off their cloth face covering immediately. They should also probably stop that activity that they are doing. And there are other examples that are specified in the executive order, but we are happy to take more questions about that in the live Q&A. We also clarify that our private schools are required to report a COVID positive case associated with their school, whether that is a child that attends their school, a staff person at their school, that they must report it to their local health department. You should, at this point in time, have a point of contact with your local health department, a person whose name you know, a person whose email address and phone number that you have. And if you do not yet have that point of contact with your local health department, we are happy to help you if you are having trouble, but please reach out to your local health department as soon as possible to make that connection. As a part of that requirement of reporting cases to your local health department, you are also required to collaborate with your local health department as a result of any of those cases. So if the local health department is determining close contacts or determining if school closure is necessary, you're required to collaborate with them and answer their questions and work together to figure out who was in close contact with the positive case and what do you need to do next. We've already issued a really helpful resource that many school leaders across the state says is not that guidance of any kind is their favorite thing, but of the documents that we've released, this is their favorite, the one they refer to the most, is what do you do when you have a positive case? What do you do next? This document is our positive screening reference guide that gives step-by-step instructions for school leaders and for local health departments in exactly who needs to take what action in a variety of different scenarios. So I strongly recommend you take a look at that. Also noting that many of you might be religious school leaders or leaders in religious private schools, we've also released a faith leader toolkit and specific guidance around places of worship that might be particularly relevant to your context. We hope that you're able to connect with your local church or your local religious institution, and that you're able to share best practices so you're able to coordinate around messaging to families around what they should be doing and around to your students and your staff. We have a few resources that we'll distribute upon the conclusion of this webinar that you'll get via email, but these are resources to share. We hinted at this earlier, but we have seen that our students in our schools are most likely to be ready to wear a mask and follow the requirements on campus, but there might be some more difficulty connecting that message with families, with parents at home. So we have a few communications resources that we're highlighting, and we anticipate more to come that can help spread common messages around best practices for COVID-19. We have some guidance that's come out on winter holidays, in particular around avoiding traveling and gathering with people that are outside of your household over the holidays, and some best practices if you must gather. Most importantly, that you would wear a mask at all times, you would keep it small and keep it outdoors, and that you get tested ahead of time. We also have a resource that's specifically family facing that outlines what they should expect when their kids are going to school in person. So that's this resource on the left. And then the resource on the right, we are ongoing updating this document with the most up-to-date research on what we know about COVID-19 and children. Another resource we want to share, and feel free to enter into the Q&A box or shoot us an email or tweet if you've already done this, but we highly recommend that you and your staff and children's parents download the Slow COVID NC app. This is a free smartphone app that anonymously notifies and is able to detect if a user has been exposed to someone who's been diagnosed with COVID-19. I don't know what the tally is now about how many hundreds of thousands of people have downloaded this app, but the more people that download it in North Carolina, there's similar apps, I think in every state at this point. They're part of a network of apps. The more we're able to track who's been exposed, who should quarantine, the better we're able to mitigate the spread of COVID. And then last but not least, we have a campaign going called Whatever Your Reason, and that it's a series of videos and social media posts where you and others can share what is your reason for getting behind the mask. Why do you wear a cloth face covering? These are some examples of the things that folks have written on their masks. others have created just really powerful images and videos that share their reasoning. It's in English and in Spanish. Many of our resources online are bilingual. We are finalizing our most up-to-date translations. It's really important that you're able to connect with your non-English dominant families at home, and we know Spanish is a primary language for many non-English dominant speakers. So we are doing our best to keep our materials translated. Would love for you to be a partner in our Get Behind the Mask campaign. Whew, a lot of resources, and you'll be able to dig into the slide deck after this conversation. But let's now take a step to dive in. It's going to say take a step back, but really we're zooming in on a couple of examples of schools that are emphasizing best practices for mitigating the spread of COVID-19 at their school. And I want to hand it off to Mrs. Beth Peters first from Greenfield School in Wilson, North Carolina, to talk to us about their best practices and protocols for a few minutes, and what they would want to, what she wants to share with her peer schools on the line across the state. Beth, without further ado, I'd love to just hand it off to you, and you have the floor to share your best practices.
Okay, thank you, Rebecca. And thank you first to the North Carolina Department of Health and Human Services for providing this forum for us today, but also for the Strong Schools toolkits and the face coverings, all that you have done and continue to do for us. And that really has helped us at our school going all the way back to March, as well as Linda Nelson and NCASE. She has certainly helped our school because we are a member of North Carolina Association of Independent Schools. And she provided weekly Zoom meetings for us beginning last March for school heads, but other cohorts within the schools. And I could not have come up with all these best practices and protocols without both the Department of Health and also Linda and her guidance through our association. So if I would say first, if you're not a member of an association, at least you can get together with schools in your area or about the same size as you, or that you have something in common with. I have also gotten together with 5 local schools around Eastern North Carolina, and we meet about once a month to share ideas. So sharing with others is one of the best ways to come up with what works and what doesn't work. This is just a list here of some of the things that we developed. And I would say first and foremost, if you haven't developed a relationship with your local health department, as Rebecca said, call them, reach out to them. I called ours this summer, and not only did they offer to help us, but they came out to our campus and looked around to see what we had, the protocols that we had set up, and they said, yes, this is good, or maybe you need to change this. So that was really helpful for us. And we hired a school nurse, and so she is in contact with the people at the health department almost daily with questions and advice and collaboration. So those first top 2 things, I guess, are just what I would stress the most. But the nurse has been wonderful. We did not have a nurse before this year, and we could not have done anything like we've been able to do without her this year, because she handles when the students get sick and figuring out who needs to quarantine and for how long and when they can come back to school, and she communicates with all the parents. So that's been a wonderful addition to our campus. We do have the daily screenings every day. We have a couple of temperature devices that are on tripods that you can just walk by, and it lets you know if your temperature is normal. So we have one for the lower school and students that drive, and another one for middle and upper, and faculty too. We just walk by it. In our preschool, we use the handheld temperature checks. But we also have screening forms that the students, either the parents for the lower school fill out. It's just a little tablet like this, if you can see up in the box, and they have to answer 3 questions. And so they have to bring that every day to school. We've heard a lot about the mask, but we, of course, are requiring those all the time. And in our hallways, we have one-way traffic, which is different this year, so that students are not meeting face-to-face. And so they enter one door of the building and exit the other, and it causes a little bit more time between classes because students are walking around the buildings. And so we added a little extra time between classes for students to get to their next class. We have a big open campus and separate buildings, so our students are going outside a lot. But now, after every class, they go outside to get back in to either a different building or the same building to go to another class. We also have, we're lucky enough to have doors that go to the outside, so students enter a classroom from the interior hallway, but when class is over, they go out the classroom through the outside door. So again, students are not meeting face to face when one student's going out, one class is going out and one is coming in. Of course, we're spacing the desks most of the time 6 feet where possible. And we've also, because we have a big open campus, we are trying to use outdoor spaces. That's going to be a little bit more challenging now that the weather's turning. But we did have a few families to donate a big tent and some chairs to set up outside. And we have other places on campus that we can use outside. We also allowed our parents and students to choose the virtual option. So we put cameras in the classroom so students can zoom in to the class while the teacher's teaching in the classroom. And we did go virtual the week of Thanksgiving and the week after that. And we have another week after this week before we get out for Christmas. And we've had quite a few with the numbers rising saying we're going to stay home until at least after Christmas. So we had more students today zooming in for their classes, but that seems to be working well, but it is harder on the teachers. And so that's something that we do have to keep in mind. I worry about the mental health of our faculty and staff, and we've added in a few more mental health days, if you will, to give the teachers a chance to just take the day off and regroup. Let's see, we added refill, because we cut off our water fountains, we did purchase 4 refillable water stations. Well, 3, we already had 1. And so the students are allowed to bring their water bottles with them all the time and refill as needed during the day. And that also sort of gives the students a little bit of a mask break, because obviously they have to pull their mask down to drink a sip of water. So parents had asked, well, aren't you giving them mask breaks? And I said, well, if they want a sip of water, they have to take that mask down and take a sip. And so that's one way that they can get a little bit of relief there as well. Our specialty teachers like art, music, PE, hands-on science, computer, Spanish library, normally the students would go to those teachers. And this year, those teachers are going to the classroom to limit their lower school classes from traveling around so much and going into spaces where other classes have been. And we're not doing the hands-on science and computer with our lower school this year just because of the keyboard sharing and other supplies that we would share. Of course, we set up the hand sanitizer stations in each room, and we're cleaning more between classes, and we've got the ionizing cleaner sprayer that we use if necessary or weekly. But if a student gets sick and has to leave, we'll empty the classroom and go in there and spray immediately. One thing that we've done is limit the visitors on campus, including parents, which in a way can be a good thing, but they are feeling a little bit more left out this year. And so we're doing a little bit more communicating via social media, or the teachers are sending home pictures so that the parents can see a little bit more and feel more connected. And then just eating is one of the concerns of our nurse when students have their masks off and eating and talking. So we've made changes with where everybody eats and trying to spread out students in our cafeteria. So that's sort of it, some of the main things that we're doing.
Thank you so much, Beth, for your leadership at your school. And thank you for following the Strong Schools NC Toolkit early on. And we're so grateful for your leadership, and thank you for speaking to the group today. We'll make sure that, feel free to go ahead and look at any Q&A in the chat that might be relevant for you, and we'll lift up any questions that we'll ask during live Q&A. Thank you so much.
Thank you.
We're gonna pivot now to Mr. Kyler Kettner from Liberty Christian School in Durham. Mr. Kettner, do you want to go ahead and share your perspectives with us?
Absolutely. First of all, I want to thank those who have worked so hard to keep us safe during this time. And Ms. Peters from Greenfield, that was very helpful. And I enjoy listening to this whole thing all the way through, but thank you for your time and putting that together. That was very helpful. Here at Liberty Christian School, and of course across many schools, we deal with so many emotions dealing with COVID-19. You know, there's emotions of hope, there's emotions of frustration, and sometimes anger, and then sometimes confusion. Because when you put something together and tell your parents and students do this, and then they don't, those are those moments of frustration. And there's moments of joy when you put something together and it works effectively, right? So it's like an emotional roller coaster. In those same times, you have parents calling you and saying, man, great job. And then you have others saying, what are you doing? In literally a 20-minute span. So as an administrator, it can be an emotional roller coaster, and that can be very difficult. COVID-19 was very personal to our school, sadly, because during the summer, we were, of course, not in session. We have 3 students here, and they lost their father due to COVID-19. And he was in the hospital for 2.5 weeks. That was very difficult for our student body. We are a more of a smaller Christian school with 250 students, so these kids know each other, and they knew about that. That was very difficult. So starting the year off with offering in-person and online learning was the best way to go for our parents and our students. Thankfully, the first 9 weeks throughout the school year, we actually had 0 cases. We did not have a case for 9 weeks. And we tried to follow the best practices we could from the CDC and the Department of Health and Human Services guidelines. And that was great. But we did end up having a cluster develop here at Liberty Christian School. And if you watch the local news here at WRAL, the picture you're seeing on your screen right now was the picture you saw on WRAL. I asked if they could use a better picture. I don't have any, but that's the picture they gave. But, you know, anytime you're interviewed on WRAL, and, you know, it's a nervous thing, but I didn't have anything to hide. I want to be very transparent and let them know that we had followed the guidelines from the Durham Health Department, and I cannot say enough good things about my local health department. They have been absolutely fantastic. As soon as the case is developed, we were closed for 2 weeks as they requested, and basically stayed with their guidance all the way through that process. And when you have to make those decisions, leadership is never easy. It's never an easy thing. You know, many people want to tell us as administrators, from even parents, sadly, you know, how to do our jobs, but they don't want to sit in the seat, right? Because when you sit in the seat, it's very difficult. And you can't please everyone. It's impossible to do. I've had, you know, parents, you reach out to me and say, you know what, because of, you know, you're enforcing masks, you're doing this and doing that, with all these things, you know, we're going to take our kids and homeschool. And that's perfectly their decision. But, you know, what I find very many times is the parent that recognizes how much work the teachers actually do and how much we're actually doing, and recognize it's not that easy. And so, you know, I encourage you, don't be afraid to stand by what you believe is the best for your students and for your community and for your parents, and continue in reinforcing and enforcing the guidelines that have been given today in this event here. I would also like to say that I'm very thankful for the help that I've received, again, from my local health department. I'm in constant communication with them. I'm on a first name basis. When I call, they know exactly who I am. And I don't know if that's a good or bad thing, but I'm assuming that's a good thing, right? And constantly talking to them and really just bouncing ideas off them. What's best? Is this a good idea? Is this not a good idea? And then trying to move forward. Also, Ms. Rebecca Blanchard, she has been absolutely fantastic, taking my calls after work hours that I would think a typical work day, and saying, hey, here's a time, reach out and get some help. And I just want to encourage, you know, there's people out there that want to assist you. You're not alone. Reach out, find other schools, as Ms. Peters mentioned, and unify together and find a way to get through this time. And I'm so excited to hear about that light at the end of the tunnel. But, you know, we're not there yet. So unify together and find solutions and continue practicing those safe things to keep our students and parents safe. And then the last thing I wanted to mention was, as a faith-based school, how has faith played a role into our response here at Liberty Christian School with our faith? And I think of 3 things right away, and I won't be long. First of all, Matthew chapter 22, verse 39 talks about loving thy neighbor. And to me, the definition of loving thy neighbor is wearing a mask, right? Wearing a mask in the classroom, wearing a mask outside in public. So we encourage our students, not only they're mandated to wear a mask inside the classroom and on property here, but when you go out, because we want to make sure our neighbors are protected, our community is protected, and we're being as safe as possible. So to love our neighbors ourselves, we encourage our students with that. Secondly, in Romans chapter 13, it talks about those who have been placed in authority over us. We're there to respect them, to adhere to what they want. The health department has been in our world from the very beginning here at a Christian school. We serve food in our cafeteria. They tell us what to do with that. We have fire inspections, and we're actually having one next week. They tell us what to do with that. So when the mask order came out, we complied, just like we do with everything else, because they're trying to keep our students safe. And we're supposed to respect those people listen to those people, glean, just like as I've listened today and heard so many different things. I've written things down and said, man, I want to try that. But again, gleaning information from those. And again, from the Department of Health and Human Services, and then my local health department, I cannot say enough how grateful I am for those people. And then 1 Corinthians 14:40 talks about doing things decently and in order. I talk to our teachers all the time about doing things decently in order in the classroom, right? Keeping your curriculum right, making sure your tests and quizzes are graded on time. You go through all those different things. But also the COVID-19 response in our schools, has to be decently in order because we're dealing with something so serious that can affect so many different lives. So again, with the mask wearing, with the temperature checks, with, cohorting and putting classes together and not let them change classes, or, as Ms. Peters discussed, so many different things you can do to try to stop the spread of COVID-19. And again, reaching out to these resources that you've been given today because they're willing to help and they want to help, because again, we're trying to do the very best to keep our kids safe and educated. So those are the things that have personally really helped me and what, we've been going through here at Liberty Christian School. I don't have all the answers, don't claim to, but I hope to have more answers after today by listening to all these great minds come together and try to do the very best for educating the children here in North Carolina in private schools. I hope this was a help, and if it was a help to one person, it was worth it. Thank you so much again for the opportunity. Have a great rest of the day. Thank you.
Wow. Just have to pause there for a second. Thank you. Mr. Kettner, Ms. Peters, thank you both for your unbelievable leadership when none of us expected to become experts on a pandemic. And I know that you both went into your work because you care about educating kids and you care about families. Maybe you are driven by your faith to do what you are doing. And none of us expected to be where we are today. So thank you. Thank you both for your incredible leadership. Thank you. Wow. I am going to transition us to live questions in our last few minutes together. And I'm going to actually hand it over to my colleague, Madhu Volimiri, who has been working behind the scenes with Jeff Coltrane and others on our team to come up with a good list of questions that we can divvy up to folks who are on our DHHS team live on the call. Madhu, you ready to rock and roll?
Yes, thank you. And thank you to everybody for your incredible engagement. These are really good questions. Hopefully our team has been able to answer some of them throughout. Hopefully you can see some answers, but we'll also take some now. Thank you again to folks. So my first question I'm going to give to Dr. Tilton. There were a number of different questions about why are we more clusters in private schools than our public schools? What do we think these are linked to? Is it sports? Is it in person? What do we think is going on there? So Dr. Tilson, I would love if you could share any insights on that.
Yes, I'm happy to. So with, again, going back to the science, right? So with a respiratory virus, of which almost 75% of people may be asymptomatic, it is very, very hard to specifically pinpoint exactly what's the exposure, what's driving it. We drill into our data all the time, but it's just a very hard thing to know with precision exactly why and where it is being spread. And so we don't know for sure. We see that data, but it's really hard to give you with any sort of credibility that I know exactly why. But again, if we think through what are those settings and situations that might increase spread, and we can think about are those being applied maybe more so in the private school setting. So with sports, right? So with sports, if you are getting a bunch of kids and they are together, and because they're exercising and they're having their increased respiratory effort, there may be some more respiratory spread in sports. If they're not wearing face coverings in sports, there's another increased chance of spread. And then how much of all of our preventive strategies of the universal mask coverings, of the social distancing, how much of all of those preventive strategies are being applied consistently across the public school, the private school setting. So it's hard to say specifically, but I think the take home is we know what works. So in the private school setting, just in the public school setting, we want there to be universal application of those preventive strategies.
Thank you, Dr. Tilson. All right. The next question I'm going to give is to Larry Michael, our head of environmental health at the Division of Public Health. And there's a question about whether sprayers are recommended for cleaning and disinfection. Could you weigh in on that, Larry?
Yes, I'm happy to do that. The first thing I want to say is, I wanted to highlight something that both Mr. Kettner and Mrs. Peters mentioned earlier. And because it just made me smile, so if having a relationship with your local health department is so critical, and I so appreciate hearing both of them mention that today. So I do want to say that. Okay, so to the question, there's so many different products and devices out there, ionization, dry hydrogen peroxide. I'm sure you've heard it all in terms of, the different manufacturers contacting you. So I'll say a couple things. Now these devices, fog, mist, spray, applied, different chemicals in different ways. So two things to remember. One, make sure that the device and the product are both rated to do what they're supposed to be doing. Manufacturer's instructions, manufacturer's use is so critical because a lot of these things are just not designed for this type of application. So just again, make sure before you purchase that it's rated to do so. And the second thing is, and probably one of the most important things, is to make sure we're not applying something that could be more dangerous. And in particular, if you look to see that it meets UL standard 867, again, UL 867, or better yet, if it meets UL 2998. Okay, those are two standards that are really important to ensure that ozone is not being created. Ozone's a respiratory irritant and can cause severe issues. So if those things aren't met, then we do not recommend the use of that device or that product. So again, just make sure you do your homework on that. If you have questions about it, feel free to reach out to us. We have industrial hygienists that can help you and provide assistance as well. Thanks.
Thank you, Larry. All right, next question to Beth. There were a number of questions about the revised guidelines that the CDC has put out about quarantine.
Madhu might be frozen. I see Jeff's face moving, and I'm going to fill in the blanks of the end of that question is when are we going to revise our private schools guidance to reflect the CDC updates? I have a feeling that's where we were going. Madhu and I work very closely together so we can actually mind read at this point. So I am it's exciting that we are able to update our schools guidance monthly. It's a big undertaking to do that. And but just know that we commit to a monthly cadence of updates across the board for our schools guidance. The CDC quarantine revisions came out, what day is today? Was it last week or the week before? It has been updated to be reflected in our public schools guidance as of last week. And as of today, our private schools guidance should be up to date online right now to reflect the latest guidance from the CDC on quarantining. And Madhu, if it's okay with you, I might actually ask John Marie to speak to those updates just a little bit more around quarantine guidance. John Marie, could you speak to that? You might be on mute.
Yes.
Sorry. Thank you.
Systems change and the unmute is never the same location. So there are changes, and we saw some questions. CDC acknowledged that quarantine can be a burden and difficult to conduct. 14 days is really a long period, 14 days after the last potentially infective exposure. So they studied, and anything we see coming from CDC is based on data. So that's why it took a while. But they came up, and there are several things to keep in mind when we listen. All of us have heard, yes, we can do quarantine for periods less than 14 days. What has not changed is the full incubation period, the time between exposure to someone who is infectious and developing infection, when that's going to lead to a secondary infection. This is anywhere between 2 and 14 days. That has not changed. What was done is, how can we come up with avenues of ensuring that we don't, we shorten the quarantine, but we don't put too many people at risk as a result of that change. And so when you shorten the quarantine, there is a little bit of a risk that is growing as you make it shorter. So that's detailed in some of the guidance that is published by CDC. The other thing, so it's either 10 days without testing. So the default, the standard is 14 days. 10 days is acceptable so long as the person has not developed symptoms and continues to wear masks and do symptom monitoring for the remaining days up to day 14. And 7 days is even also acceptable if there is a test, and they say the test could be collected up to 48 hours before, so you can get the result. And same thing, continuing to wear a mask and do symptom monitoring and ensure no symptoms. If symptoms develop, then that is a suspected case, and you would go from quarantine to isolation. But the other thing I would like to call your attention to is the first 2 lines in the CDC guidance is local public health authorities determine and establish the quarantine options for their jurisdiction. So we know that there was a question. At the state level, we have communicated to all health departments that, especially with situations that involve congregate living settings and people who are vulnerable and likely to develop severe illness, and we have nursing homes in mind, we have prisons and jails, for example. In these situations, it's more prudent to keep to the regular 14-day quarantine. We know that there are some different people, private persons and schools, who are asking, well, why is my local health department not following CDC guidance? They are given this option by CDC, and we have not talked, this is very new, this just came last week. We haven't discussed with health departments at a broader discussion about that. So we're aware that there are some people who feel frustrated that the new guidance is not systematically applied. Sorry for the long answer, but it's going into the details. And I'll do
are you
one last word.
Anything for you, Jean-Marie?
Well, related to quarantine, there is such thing as critical infrastructure. Some people go back, and education is listed in the industries that are listed as critical infrastructure. That I want to address now also, because we're talking about quarantine. It is not a path to quarantine. It is simply saying that there are certain industries and sectors of activities that are essential and should continue. But really, we're talking about situations where if that particular person is so needed that the operations will not continue if that person is not present, and they've been exposed but they are asymptomatic, they can go back to work. That's what it opens up to. But there's very clear wording in the CDC guidance also that says it's a last resort and only in limited circumstances, such as when cessation of operation of a facility may cause serious harm or danger to the public health. So just wanted to place that because it's not a path to quarantine.
Thank you so much for that clarification. That's a question we get all the time, actually. What qualifies as essential, and could you skip quarantine? And ultimately, it sounds like the answer is you're probably our school leaders would not be able to get a pass on quarantine for their teachers. We can talk more about that in a one-off situation. Thank you, Jean-Marie. And thank you, Madhu, for facilitating that Q&A. Want to be mindful of folks' time. A couple of things. You will receive a recording of this entire webinar in an email, hopefully within the next hour, because we need time to make sure that the file uploads online. You'll also get an email with this entire slide deck. So it'll have a link to the recording, a PDF of this slide deck. We'll also be working on over the next couple of days some written out answers to questions we could not get to during the live Q&A, and that we might not have been able to answer in writing, in the actual chat box. But let's close out. It is 12:30 on the dot. We have an ask of each of you, a call to action. As you get this email in your inbox, will you please communicate with students, with staff, and with parents this week, today, tomorrow, about what you learned, what resources you got, particularly how to be safe this holiday season? Because as Dr. Tilson showed us in that map, with more and more counties turning red, we are concerned, particularly leading in to the holidays. Avoid travel and gathering with those you don't live with. Keep it small and outdoors. Wear a mask. Get tested ahead of time. Share the email you get with 3 other people that are not a part of your school, and share all the resources with your entire. Maybe you could talk about it in a staff meeting. And then for the rest of your community, post on social media about why you are getting behind the mask. I think the hashtag is Get Behind the Mask. So please put that hashtag on. We'll add that to our follow-up email. We would love to retweet whatever you post on social media. But show yourself wearing a cloth face covering. That has a huge impact on your community. More than anything, thank you for your leadership today. Thank you for joining us and spending an hour and a half together. Thank you, Mr. Kettner. Thank you, Ms. Peters. Thank you to the entire DHHS team and the governor's office and the Department of Administration. Don't forget, you have great resources available online to you. These will all be in the email. But in particular, if you haven't already, please read the requirements and recommendations for non-public schools. We need you as leaders to stop the spread of COVID. Thank you for all that you're doing, and have a wonderful rest of your day, and happy holidays.